the other thing that's been cool about this is that because so many more patients are doing this, we're doing a lot more implants. And I mean, what do you feel like as far as how that's affected us on economy of scale?
Well, I think that's a fun thing that you bring up, and the fact that, okay, so about a year ago, we dropped all of our general dentistry.
Right.
And we decided to go to doing implants and implants
100%.
all the time. And it's been fun because, okay, so about 4 months ago, we started doing the fixed zest prosthesis, and the amount of implants that we get to place now has gone up significantly because more patients are accepting the treatment plans to do a fixed prosthesis with 4 or 5 implants, or 4 or 5, 6. It's whatever I know we can get in there, but it's been fun. I mean,
well, and you know what? The other thing that I found that is so cool is because it's the locator system, it doesn't matter what implants are in there.
Oh yeah.
We can basically mix and match. It's like it doesn't matter because you're still just using the locator system to provide the solution.
Yeah. Patients 20 years ago had
exactly. They get like a brand mark or whatever like that, and then you're able to slap the locators on it, and it's just like a do-all. Like that patient that we actually had where they had the old style bar where you're doing the hater bar and you're snapping on, and then you had a couple more implants and you can just go straight to a fixed solution. It's like done. And then they're not dealing with taking it in and out, and you're dealing with brand mark implants, and it's like it just creates really simplified solutions that you may not have even realized were within your practice.
Yeah, which is, again, it's pretty interesting, the fact that we're able to take a lot of these patients who have other implant systems or what, but the costs at what we can provide that at, I mean, it's amazing. And so that's what I think that makes the treatment planning so easy, is our ability to provide a cost-effective prosthesis. It's been awesome.
Yeah, especially like, if we have someone who already has a snap-on and they have the denture, you're just popping in 2 implants, let it heal, and then you're just converting that denture really quick. And so you can really, create a solution where you give them that type of temporary prosthesis using the original denture, and then once they're able to get financially in a place, you're able to then, upgrade them and add a bar and do the sort of a final prosthesis modality. And that's, I think, as practitioners, what we're always looking for is being able to evolve and be flexible and in solving problems.
Yeah, it's nonstop. Every patient that walks in, they got a problem. And,
always.
And this is just another tool that we have in our kit in order to solve that problem. Between the, like we've talked about, fill the gap between the snap-on and you have the fixed prosthesis. We really fixed hybrid, we really have something that's right there in the middle now that so many patients, like I said, when we share them what they could do, they jump on that. Well,
and what do you think as far as, to me, with what's happening with the digital workflow system and printable dentures, and using the intraoral scanning with the printable dentures, I think that this system really lends itself to kind of where things are going.
Oh, I think that's the future of dentistry. I think that we're working, dentistry's only pushed more towards that direction, and this system really does allow you to do a lot more of the printed in-office type.
Well, especially as the materials are evolving, because I mean, the thing that's been crazy is that with the printers, how quickly we're getting new types of biomaterials within the printers, and what we have now versus what it's going to be like in 3 to 5 years, who knows? It's just evolving so quickly, and I think that having the more types of solutions you have as far as this digital workflow with what's happening and integrating it into your office is going to put you ahead down the road.